Good morning, everybody. I know this is not the normal time frame that I would go live. However, um, I need to address some other things later on this evening, and really felt like you know. Sometimes when I do these lives, sometimes they're planned, sometimes they're not planned, and sometimes they're just because like something happens in the morning or at some point during the day and I begin to connect some dots in my brain. And, it's been, gosh, 7.5 months now since we were, outside of Holston Valley Medical Center and peacefully protesting, 24/7 in an effort to save our healthcare and to get the state of Tennessee, the Department of Health, or Ballad Health themselves to do something different with regard to the way that this COPA is being done. And this morning, after such a long time and not being for a very long time, my world literally centered around Ballad Health, right? Um, Lisa, I would recommend watching the one from the night before, even. But hey, good morning, Susie. And I was immersed in the COPA and the announcements and their SEC stuff and their bonds and and their political ties and lobbying and donations, and I kind of have still kept my finger on the pulse of Ballot Health, but I haven't been very much immersed in it. And then this last week and a half, that's definitely shifted a little bit. And this morning, when I was brushing my teeth, believe it or not, I came back to this one paragraph, well, these two paragraphs in the actual executed version of the COPA. So understand that Ballad Health's Certificate of Public Advantage, called a COPA, there is the executed version, which is like a very short 3-4 page document. And then there's the long like terms of certification. Hey, Patty and Pat. Hey, good morning, Robin. And when I went back, I remembered the very first annual COPA hearing that about 450 of us attended and spoke at, and I kept coming back to these two paragraphs. And this is the executed version of the COPA, and this is page 2. And I'm throwing this out here because I think that it's worth discussing. And I actually think that it's worth contacting the Department of Health and their planning department, which would be Jeff Ackerman, Judy. I always say Connect. I have no idea how you say her name. It's Knecht. And even Commissioner Piercy, although the Commissioner of Health, Lisa Piercy, never answers her own emails to regular citizens that I'm aware of. She hasn't. Anyone that I know, right? The only person I've ever seen her respond to is an elected official. Good morning, everybody. Good morning, Melissa and Mookie and Harry. I think that this would be a great time to email those individuals again, and let me share with you why I think so. So, in the executed version of the COPA, here's what it says. Pursuant to Tennessee Code annotated 68-11-1303G, this COPA is subject to modification if at any time the department being the Department of Health, the department determines that the likely benefits resulting from the cooperative agreement no longer outweigh any disadvantages attributable to any reduction in competition that may result from the cooperative agreement. It says the same thing about termination. So if at any time the Department of Health determines that the disadvantages, that the benefits, the potential benefits from the COPA no longer outweigh any disadvantages that are attributable to the loss of competition because of this COPA, then that COPA can be modified and or terminated. Now follow my line of thought process here, because in the past, when we've emailed the Department of Health, we've talked about specific instances where one patient has had a disadvantage or the region experienced a disadvantage with the loss of the NICU, or the region experienced a disadvantage with the downgrading of Holston Valley Medical Center's level 1 trauma center to a level 3, and the loss of those specialists and those specialties on call, on staff, 24/7. And what I would gather is that for the Department of Health, that didn't outweigh any potential advantages of this COPA. In other words, the monetary possibilities that Ballad had for this region, right? This $308 million that they were supposed to invest in this region over 10 years, outweighed the lives and the health and well-being of the people affected by those changes, right? Because that's specifically what this document says. It says that if the advantages, the benefits that are coming from this cooperative agreement no longer outweigh the disadvantages, then the COPA can be modified or terminated, which means, if you flip that the benefits of this cooperative agreement have outweighed the disadvantages so far, which just boggles my mind. But now follow me on this thought process. Ballad Health, of their own volition, has talked in the media at least 2 times in the last 2 weeks about their finances. They have talked about the fact that their finances are in trouble. They have talked about the fact that they blamed it on COVID. I don't know that I believe that it's COVID, although here's what I will say. I am not going to say that part of it is not from COVID. I do know they got a ton of money from the CARES Act, right? However, they were in financial trouble a year ago this time. So if you go back to their SEC, their bond review, so the bonds that they got, right? They have to get that reviewed, $950 million bonds, and their documents that they filed to the SEC. They specifically outline in that document that the funds that they plan to have to make their bond payments, that they currently don't have it in the bank. That's what this bond document says. And it says that the money to pay these bonds is going to come from merger synergies, right? And the future profits. And their revenue was down fall of 2019. And in that SEC document, in that report, it says that, this drop in revenue was a concern, and that it may result in a lowering of their bond rating. And that was before COVID, guys, right? So just follow my thought process. If we know that at least a year ago, Ballad's revenues were already declining, right? There was already, they were already missing their projections in terms of the revenue that they thought they were going to have coming in. And their bonds were already subject to a potential lowering of the rating if that continued. And we know that it has in fact continued. When you couple the fact with Ballad Health having monetary difficulties, and this last incident where Greg Neal, their CEO, and their cardiothoracic surgeon, Dr. Nathan Smith, if you couple those two things together with Greg Neal practicing medicine without a license and cutting open the chest of a patient for an open heart surgery without that patient's knowledge or consent. When you couple those two things together, here's what I think. We have no choice with regard to surgery here. If you are going to have an open heart surgery, you have to go to Ballad Health. If you are going to have an orthopedic surgery, if you're going to have neurosurgery, if you're going to have whatever. Now, those physicians may or may not all be Ballad Health, but all of the hospitals, they own every hospital between Roanoke and Knoxville, except for Morristown, right? Like but Morristown doesn't have all the same stuff. So follow my thought process. It talks about a reduction in competition. If these disadvantages are attributable to a loss of competition, I would stipulate that not having any other choice in hospital where to go to have cardiac surgery or any of these major surgeries is specifically attributable to the loss of competition, because had this happened 3 years ago at one of their hospitals, you could have gone to the other. So had this happened at Wellmont, you could have gone to Mountain States Health Alliance. Had this happened at Mountain States Health Alliance, you could have gone to Wellmont. And the same thing for all of those other patient deaths and immediate jeopardies that I talked about in my live last night. So think about this. If there have been several patient deaths attributable to unsafe environments or lack of staff following standards at these hospitals, and there's been an administrator, right, that cut open the chest of a patient without a medical license, and there's no longer the promise of all this money for Ballad. Think about this. This is what I'm saying. Guys, by their own admission, they are having money troubles, which means all of those benefits they promised the Department of Health, all of those benefits they promised the state of Tennessee are no longer on the table. Right? So if the monetary benefits are in jeopardy, do those benefits outweigh the now disadvantage we have of not being able to choose any other hospital because they are all owned by Ballad? So I would stipulate that this last incident is kind of the nail in the coffin when coupled with their current financial difficulties. And I think that that's one hell of an argument. So what I intend to do is put together an email today and send it off to Jeff Ackerman. I will post my email for your public consumption. It's a matter of public record once I submit it anyway. I will do that. What I would recommend is that you do not use my email verbatim, because then it just becomes like this chain email and it is not significant. What I would say to you is that if you so desire to send an email to the Tennessee Department of Health and to Jeff Ackerman and those individuals, I would recommend that you share any personal experience that you've had, any direct knowledge that you have of such experiences, and couple it with Ballad's own quotes about their financial status. So that way, what you are demonstrating is that, listen, the money was the only reason to do this, right? And this entire region having no choice about about a hospital in which to have their surgery, where someone in the room does not stop an administrator with no medical license from cutting open the chest of a patient. There's nothing that outweighs that. There's nothing that outweighs that. Follow me. It's not just about Greg Neal and Dr. Smith. It's not just about Nathan Smith and Greg Neal. It's not. It cannot be. And here's why it's not. In that OR, there is a room of people that need to be there. You know, you have your nurse that's assisting the surgeon. You have, the anesthesiologist. You've got the surgeon. You've got the administrator. You have, multiple people in that OR. And absolutely none of them felt that they had the authority or the voice to speak up When that administrator took a scalpel and cut open a man's chest, no one spoke up in that moment and stopped it. No one said, this is wrong, time out. Nope, we're not doing this today. They watched a potential crime. Well, it was a crime. It's at least a Class B misdemeanor, but it could be a potential felony, right? It could be a potential felony. They watched a crime committed in the operating room and no one stopped it. That clearly outweighs any potential advantage that we have from this COPA, because we have no choice about any other hospital. Every hospital is owned by Ballad Health. And now that their money is in trouble, the potential benefits long term cannot outweigh that disadvantage. You're welcome, Mike DeVoe. Right, Anthony Hill, they are trained to stop it. And so this is the thing that I really want everyone to grasp. This has to do with the culture. This has to do with the environment. Think about this if you are in your own job. If you are in your own job, no matter what you do for a living, and everyone in the room is scared to speak up to a single administrator and stop this from happening at that moment. It's great that they, like Ballad Health was like, toot, 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 toot. We're tooting our horn because look, they reported noncompliance. Okay, stop. Toot, toot, toot. No one stopped a crime from being committed in your operating room. No one. No one stopped a crime from being committed in your operating room, and that speaks clearly to the environment that you have created. In fact, I would say that this, if you look back at their statement that they made in March, when it was leaked about those cardiac deaths, right? When that information was leaked to me, which by the way, the end result of that investigation was that they did violate regulations and they did break the law. I have the letter from the Department of Health, the licensure of healthcare facilities. They sent me my letter and said, yes, ma'am, we investigated. We found that they violated regulations and they broke the law. That's what my letter says. So follow me. They did stuff wrong. And their response to that was to put in the paper, Lindy White, another hospital CEO and president of another market for Ballad Health, said whoever leaked that information, we're going to do whatever we can to find out who you are and take the appropriate action. Listen, when you threaten your workers publicly and say, hey, if you speak out when we do something wrong, we're coming for you, you create an environment where in an operating room, not a single person in that room spoke up to stop a crime from being committed. There is no amount of money that outweighs that disadvantage for this region of 1.2 million people. And while I say that, the people in the room, it is still your responsibility to speak up despite being threatened. A patient's life was at stake. So here's what I'm going to say to you all. Okay? Like I said, I am putting my letter together today. I would strongly encourage, if you feel that the COPA and not having any choice in your hospitals is a disadvantage that far outweighs the benefits of this COPA, I would encourage you to do the same thing. Right. And Luann, I understand that employees have job fear, but at some point in time, you have to do the right thing regardless of job fear. At some point in time. And if you're in that operating room, you took an oath to do no harm. You have a requirement, you have an obligation to the patient on the table to do the right thing regardless of your job. You have an obligation to do the right thing. Just saying. All right, so that's my spiel for today. I needed to get this out now because I'm going to be posting the information later for you, along with Jeff Ackerman's email address and email addresses from the other individuals. Julian Jones, signing a paper giving consent to do the surgery is for a specific surgeon to do the surgery, not for a hospital administrator with no medical license to pick up a scalpel and cut someone's chest open. That is not informed consent. So like there's actually requirements for a patient to have informed consent. Just because a patient signs a paper doesn't mean that they have informed consent. So a surgeon has to actually outline the benefits and the risks of every potential option. Every potential option. So let's just say this. If I agree for a surgeon to do a surgery on me, and that surgeon has not said to me, this is the percentage of risk associated with this. This is the potential, and this is the percentage of patients in which this thing happens. And these are the other options, and here are the potential outcomes for those options. If the surgeon does not tell me all of those things, even if I sign the paper for that surgery, I have not given informed consent. I've given consent, but not informed consent. So if this patient obviously gave consent for a surgery, they did not give consent for an unlicensed administrator to cut their chest open. There we go. Yes, state and federal whistleblower protections are also helpful. Becky, I'm not sure who you're asking about. And when you say who was the person. So, okay, that's all I have for you this morning. On a side note, I know some of you all are confused and conflicted when you come to my page, um, because you are going to see me talking about different issues that are important to me. Um, and I'm going to address them. So let me just be clear about this. I 100% am appreciative and grateful for your support of what I do and your approval of my views or my subject matters or the things that I address is not required. So I am going to address Ballad Health and any other political healthcare corporate corruption that I uncover, and I'm going to address systemic racism and discrimination. And you do not have to like that those two things exist in my world, but they do. So when you follow me, understand that you are going to see me address a multitude of things, and that's what I do. And so never mistake my gratitude for your support as a requirement for your approval, because they are not one and the same. Got it? All right, perfect. All right, I appreciate you guys. Have an amazing day. Be amazing, be light, be love, and I will see you at 9 o'clock tonight. Peace.